Have you ever experienced a strange, persistent itch somewhere on your body, with no clear reason? No mosquito bites, no allergies, no new products, just an itch that keeps coming back. So you ignore it, thinking it's just dry skin. But if you're over 60, these seemingly minor signs shouldn't be taken lightly. In today's video, I want to share something that could actually save a life, if caught in time. 5 specific itchy areas on your body could be early warning signs of cancer. And they often appear before any pain, swelling, or fatigue. Sign 1, itchy lower legs, warning of lymphoma. A deep, nagging itch on your shins or calves, especially at night. No rash, no swelling, no relief from lotion. Sound familiar? Mr. Tan, age 72, once shared how he kept scratching his shins with no visible cause. He tried dermatology creams, nothing worked. Then he started losing weight and feeling fatigued. A full body checkup revealed early-stage lymphoma. Why the lower legs? Because our lymphatic system is highly active there. As cancer cells grow, they release inflammatory substances that stimulate the nerves under the skin, causing a persistent, deep itch. If you have an unexplained itch that won't go away, no matter what you try, please see your doctor and ask for a blood test or lymph node check. Your body may be sending out its first cry for help. Sign 2, itch between the shoulder blades, don't ignore the pancreas. An itch deep between your shoulder blades, the upper back. You might think it's just from sweat or tight clothing. But if it persists for weeks, has no rash, and doesn't go away with creams, it could be an early sign of pancreatic cancer. When a tumor blocks the bile duct, bile builds up and causes itching through nerve irritation, especially in the back. Ms. Hong from Baclu came in with just one itchy spot on her back. An ultrasound later found a small tumor at the head of her pancreas. Because it was discovered early, her treatment was timely and effective. So if you have an unusual back itch, especially with dark urine, pale stools, or unexplained fatigue, get your liver and bile ducts checked. Sign 3, itchy scalp with no flakes, possible leukemia or skin cancer. A scalp itch that doesn't go away. No dandruff. No rash. You change shampoos, keep your scalp clean, but the itch persists. Some cases have shown that persistent scalp itching may signal early leukemia or skin cancer of the scalp. Cancer cells can trigger immune reactions that irritate scalp nerves, especially in those with thinning hair or bald spots. Mr. Lam, 73, from Hugh, felt an odd itch behind his ear. No visible issue, but blood tests showed elevated white blood cells, and a biopsy confirmed early-stage blood cancer. Scalp skin is hard to see, so ask a loved one, hairdresser, or nurse to check for bumps or red patches if you feel constant itching with no cause. Sign 4, itch around the chest or breast, inflammatory breast cancer. An itch around the chest or breast, often in one spot that comes back every day. Many think it's due to tight bras, sweat, or detergent. But if it doesn't go away, it might be more than just a skin issue. This could be inflammatory breast cancer, a rare, aggressive type that doesn't always show a lump. It may start with thickened skin, mild heat, or redness, or just a weird itch. Ms. Liu, 69, from Ben Tray, felt a persistent itch around one breast. Later, the skin became slightly rough, like orange peel. She was diagnosed early, and her treatment went well. Men can get breast cancer too. Mr. Kwong, 72, had a mild itch near his left nipple. A mammogram and biopsy confirmed early male breast cancer. So if you feel a recurring itch in one area of your chest, especially with skin changes, nipple discharge, or underarm lumps, see your doctor without delay. Sign 5, itch around the genital or anal area, don't stay silent. This one's hard to talk about, but it's one of the most important. If you or a loved one has an itch around the anus or private area, and it lasts for weeks or months despite good hygiene, creams, and diet, please get it checked. Mr. Duong, 76, had an itch around his anus for nearly a year. He thought it was hemorrhoids. But after a colonoscopy, doctors found early-stage anal cancer. Ms. DM, 68, from Ken Jeong, felt persistent itching on one side of her vulva. No medication helped. A biopsy revealed precancerous cells in the vulva. Don't let embarrassment delay a checkup. Your life is more important than discomfort. If the itch is only on one side, lasts long, feels hot or bumpy, get a specialist to check for any signs of rare genital cancers. Closing thoughts. Dear friends, the 5 itchy spots, lower legs, upper back, scalp, chest, and private areas, may seem harmless, but they can be early warning signs of something serious. Not everyone who itches has cancer, but a repeating itch in the same spot, with no obvious reason, deserves attention. Your body is always talking to you. Not with words, but with feelings. And when you choose to listen, you give yourself a chance to live longer, stronger, and healthier. If this video has helped you, leave a comment. Even a simple "I'll pay more attention" could be the wake-up call someone else needs too. Thank you for watching. May you always stay healthy, peaceful, and aware, one small sign at a time.